First and foremost, the NAD recognizes that the needs of each patient should be addressed on an individual basis, and the hospital should recognize and respect the communication needs as stated by the patient or family. In a patient-centered environment, the participation and input from the patient is crucial. The healthcare team should use the patient's input to determine what the most effective communication will be for the patient. For deaf patients who know and use sign language, the hospital should always offer on-site interpreting services and/or VRI immediately, whether or not a patient requests the service. Some patients may not want to use or wait for an on-site sign language interpreter. Some patients may prefer VRI or some other form of communication access. The hospital should defer to the patient's communication needs and requests. Ultimately, a patient's medical care should never be delayed or compromised while waiting for communication access or deciding on communication needs. However, in all other situations where VRI is used and the patient requests an on-site sign language interpreter, the NAD views VRI as a service that may, quote-unquote, fill in the gap until an on-site interpreter arrives at the hospital. The NAD strongly believes that VRI services should be provided only if on-site interpreter services are unavailable. If VRI services are used, the following minimum requirements should be adopted by the hospital. These requirements need to be addressed with potential VRI vendors that the hospital employs to provide its VRI services. Number 1. High-speed internet connection. Number 2. Appropriate size, proximity, and position of the video screen. Number 3. Appropriate camera angles and focus. Number 4. Appropriate audio quality. Number 5. Private room should be provided for the use of VRI to minimize distractions when at all possible. Number 6. Equipment should be portable when feasible so that the equipment is available where the patient is located. Number 7. Hospital staff must be trained on a regular basis on the procedure for setting up equipment and calling the VRI provider. And number 8. Hospitals should work with the deaf patient to make sure they receive the most appropriate communication method and determine whether or not the VRI interpreter is qualified. The full list can be found at www.nad.org/2008 capital VRI, lowercase, position statement.